I think it's like other things that are tragic. People don't think it's going to happen to them until it happens to somebody that's close to them or someone that they know. My name is Valerie Pfander. I am a clinical nurse specialist and I live and work in Traverse City. There was a lot of stress back in the beginning. There was a lot of changes happening every day. There was a lot of fear and uncertainty. Nobody knew what was causing the virus or how to treat it, and we had patients that were afraid to come to the hospital because they were afraid to get COVID, and we had staff that was afraid to take COVID home to their families. So it was just really a stressful time. And there was, people dying, and there wasn't a lot of answers at the time back in the beginning on, why this was happening and what we could do to fix it. People in rural areas are more at risk because there's not always the access to health care that there is in some of the big city areas. People don't have ways to get to the hospital or to travel or to get the care that they need, so they're more at risk because they don't seek out health care when they should or when they can. Vaccines made a huge impact. We were still seeing a lot of people that were getting COVID, but the illness wasn't as severe. They were having less severe symptoms. Not as many patients were getting hospitalized, and the ones that were getting hospitalized weren't necessarily being put in a critical care unit or needing an artificial airway to survive. So the illness was less severe after the vaccines came out. Everybody has known somebody who's had COVID for sure, and quite a few people, myself included, know people that have died from it and have had it impact our family. I would just try to reassure people that the side effects from having the vaccine are going to be less severe than the side effects or possibly long-term effects from having the virus. I know some people might have been hesitant because they thought that the vaccine wasn't affecting some of the latest variants going around, but we now have updated boosters here that will impact the variants. And so if you're hesitant to get the vaccine for yourself, one good reason is to protect others around you, your parents, your grandparents. People who have a chronic illness are more vulnerable, the elderly are more vulnerable. COVID is not over yet. We're still seeing patients in the hospital every single day. We know a lot more about vaccines now than we did back in 2020, and we know a lot more about the virus and how to make it go away. And I truly believe that getting vaccinated will help keep our community safe. I know that there's been a lot of death and a lot of tragic loss in the last couple of years, and I don't want people to have to experience that if they don't have to, and I think vaccines will help prevent that. Please get vaccinated against COVID. I don't want to see anybody else lose family members. There were so many losses during the pandemic, and I don't want another family to experience some of the tragic losses that we did.